Hello, I'm Dr. Chen. In today's tutorial, I will be going over how to position and scan the ulnar nerve. To scan the ulnar nerve, let's position the patient's palm facing upward. We will place the probe in between the elbow and wrist, slightly toward the ulnar side. Let's start the scan in the transverse view. You can set the depth to around 3 centimeters, depending on the patient's size. First, we will identify the ulnar artery. You can apply slight compression to confirm the pulsating structure, that is, the ulnar artery. Then, let's check on the ulnar side to see if there's another honeycomb-like structure nearby. As you scan more toward the elbow, the nerve becomes more clearly defined. At this level, we can see the two structures separating from each other. Keep scanning upward this small spindle-shaped structure. In the center of the screen is the ulnar nerve we're looking for. I hope this is helpful to your practice. That's all for today's tutorial. I will see you in the upcoming videos.